Another way to approach the TL junction is by getting releases through the heel. And in order to do that, it's basically a long lever technique. In order to do that, you can get very specific when you understand how to unwind this area and then connect it to the heel. And so two main adjustments that we've been utilizing recently is a release of the QL. When releasing the QL, typically what you'll feel is a contracture here and then a lot of energy around the T12 rib or the T11 rib on the posterior region. What you would do then is you would go clockwise superior on the side where you're having the contraction, and then you would get a release through the heel. Now, something else that you can do is get a release actually through the joint of, say, the T12 on L1 or the T11 on T12. And typically what you would do is you would go towards the side that you're going to then distract the heel. And so for our person here, I am feeling that there is compression right here, basically at the T12 L1, and that compression has some relief as we have a counterclockwise torque. And so I'm going to torque into his left side heel, and I'll show you the distraction. So Darren, if you want to come, provide that torque. So by having someone anchor exactly what area that I'll be distracting into, I can get real specific with a long lever distraction. So what I'll do now, Kyle, if you want to look here, if you actually want to get a wide view, what I'll do is I'm going to distract until I start to meet Darren's hand. So the more I've been studying biotensegrity, the more I've realized how, again, everything's interconnected and you can leverage where you want to connect to specifically. Now for our friend here, his calcaneus is actually a little bit hypermobile, so I will move up the leg. That's better here, so I'm getting basically a distal calf connection, and then I'll traction right into Darren's hands and then pull. There it was.
Cavitation. Okay.
What you'll get is full cavitation, usually at wherever you're having the anchor at. So if I'm stabilizing T12, the T11 or the L1 will pull off S to I and decompress that area through the heel, especially when you traction it right to that area. So that's a very effective adjustment to get relief in the low back. Something to be aware of, again, is did the person have any old Achilles injuries? Do they have any knee injuries or hypermobility, ankle hypermobility or immobility? If they have a hot low back, I don't suggest this. Also making sure that you're clearing the tension through the hip socket. So if you distract to the hip socket, then you'll pull the hip socket, right? Which is okay if that's what you want. But if you want here, you got to continue tensioning the system all the way to that, and then your force will travel through the hip socket to that joint and distract that joint. So make sure you're being specific with as much as possible to where you want to go. But this is a great strategy. A lot of people do not like to unwind at the T12 area going I to S, which is surprising because that's all we get taught, right, usually. So you can also go S to I. And you can do it as a QL release, you can do it as an actual joint release, and believe it or not, you can actually do it at the level of the cord as well. So remember, when you're doing QL, typically you'll create more space on the same side. When you're doing the joint, typically you will go towards the side that you're going to distract, so you'll go down. Hope that's helpful. It's another way to address the thoracic spine.